According to the Center for Disease Control, there have been 1,234 reported cases of measles this year in the United States. Measles can spread quickly when it is introduced to a population where people are unvaccinated. The Needham Public Health Division suggests people receive immunization against measles and for other dangerous diseases as well, to protect yourself and others around you. Here's more on the recommended vaccines.
Vaccines are important to help prevent against certain diseases. They were created in a way to help those communicable diseases that are easily passed from person to person, for people to avoid those and not get as sick and not get others as sick as well. So especially at the beginning of the start of school, getting those vaccines that are required or that are recommended through the state health department is important, because you not only protect yourself, but you protect others or friends and family who can't get protection due to maybe health risks or pregnancy or things like that. The required school vaccines are generally the MMR, measles, mumps, rubella, hepatitis B, you've got the rotavirus, and you've got TD or Tdap, depending on what age and what grade you were in. There are others that are recommended, such as the HPV, but they are not necessarily required to be able to get into school. Many of the vaccines, such as hepatitis B and the HPV, will help prevent cancer later on in life, so that is why they're recommended to get as well. We know that measles is still a concern throughout the United States, and especially with travel and all the different areas that you can contract the measles. So we do recommend receiving the measles vaccine. It helps with what's called herd immunity, which allows those who can't receive the vaccine due to health concerns, helps protect them from receiving such a dangerous disease such as measles. CDC is still watching the rates of measles at this current moment, but we do recommend that everybody who needs to receive one or hasn't received one call their provider and get a measles vaccination. We at the Needham Health Department definitely recommend getting all required immunizations and recommend talking to your doctor about those immunizations that are recommended. They are safe. Vaccines have been tested multiple times. The only ones that could possibly be of concerning are to those people who have maybe immunocompromised issues or are pregnant. Those you definitely should talk to your provider about before receiving vaccinations, just to make sure you don't get sick. But otherwise, they are completely safe for all other people in the order that they're recommended and within the age group they are recommended for. If you do have any concerns about vaccinations or whether you should receive them, or even if you don't know if you have received them in the past, then you can go to the provider, and ask them about getting a titer drawn for that specific vaccination or immunity, and they will be able to tell if you have immunity to that disease or not against that vaccination. If you don't, you can talk to your provider about what's the best option for either a catch-up schedule or a booster shot, or what is needed as far as that goes.